Okay, guys, so today we're going to go over the different types of hearing loss. By the end of today's lesson, you'll have a better understanding of the different types of hearing loss, their causes, diagnostic testing, and the nursing considerations when caring for these patients. Okay, guys, so hearing loss is when the hearing acuity is decreased. Okay, so this can be caused by alterations in the external, middle, or inner ear. So sound in general is transmitted by air and bone conduction. So basically, this is how the person receives sound. So usually, air conduction of sound is more sensitive than bone conduction. So if a person's hearing is decreased, this is characterized as conductive, sensorineural, or mixed. And we'll go into each of those types in a little bit. Okay, so we're going to go ahead and start with conductive hearing loss. So with conductive hearing loss, this is a physical obstruction of sound wave transmission. So something is blocking those sound waves from being transmitted. So this is a problem in the external or middle ear, and it prevents the sound waves from getting contact with the inner ear nerve fibers because of a disorder or abnormality in the external or middle ear. So let's go ahead and talk about some of the common causes of this type of hearing loss. So, like we said, it's caused by obstruction of the sound wave. So really any object that can cause obstruction in the ear can cause this. So cerumen or earwax or foreign bodies can cause this. And really these just cause inflammation or obstruction in the external or middle ear, which prevents sound wave transmission. So it can also be caused by eardrum changes, so bulging, retractions, or perforations in the eardrum. This can also cause this type of hearing loss. So these may indicate damages to the middle ear structures, which can lead to conductive hearing loss. Infection in the external or middle ear could also contribute to this type of hearing loss as well. So finally, abnormal tissue growth such as tumors, scar tissue, or overgrowth of soft bony tissue on the ossicles known as otosclerosis can also lead to this type of hearing loss as well. So the good thing with this type of hearing loss is that the disorders that cause this type of hearing loss can usually be corrected with minimal or no permanent damage. So remove the obstruction and the hearing improves. So let's go ahead and give this guy a little earwax here. Okay, so he's got quite a lot of earwax buildup in his ear, which is preventing the sound waves from being transmitted. So it cannot be transmitted. So if we remove that earwax, then hearing improves and everything is good to go. Okay, guys, so sensorineural hearing loss is a defect in the cochlea itself, or a defect of the eighth cranial nerve. So that's the auditory nerve. Okay, so this is also caused by damage to the cochlear hair cells as well. So unlike conductive hearing loss, sensorineural is a problem in the inner ear. Remember, conductive was external or middle ear. Some of the causes of this type of hearing loss include prolonged exposure to loud noise, which directly impacts and damages the delicate hair cells of the inner ear. So presbycusis, which is the most common type of this kind of hearing loss, it's basically just the natural aging process of the auditory system. Okay, Ototoxic medications can also cause this type of hearing loss just by damaging the inner ear structures. So a lot of times these are like antibiotics, and just making sure that if they are ototoxic medications, we are giving them as they're indicated, just to try to prevent any kind of damage that we could possibly, give to these patients. And unfortunately, this is often permanent damage to the inner ear. So the focus is to prevent further damage to the ear and implement interventions to prevent it from getting worse. Okay, guys, so mixed or combination hearing loss, this is literally just a combination of the two different types of hearing loss. So it's a combination of conductive and sensorineural. So a lot of times these patients can have a pretty profound hearing loss just due to the nature of both of the types of hearing loss occurring at the same time. So these patients will have a problem in not only the inner ear, but also the middle and external ear. So a cause of this could just be like an elderly patient who has a sensorineural hearing loss at baseline, who just develops a new ear infection or has cerumen impaction. So both of the types of hearing loss are occurring at the same time. Okay, guys, so let's go ahead and look at the different assessment findings with conductive and sensorineural. So in conductive hearing loss, you'll see an actual obstruction in the ear. So this is, when you're looking at the ear with an otoscope, you're going to see something is in the way that's blocking that sound wave transmission. The tympanic membrane could also be abnormal. Like we said before, it could be bulging or perforated. So you could see that upon examination. These patients could also have a softer tone of voice or may speak softly as well, just kind of one of those things that they could present with. And normally they hear better in a noisy environment. So I'm going to go ahead and just briefly talk about the Ryan and Weber test, but we're going to go a little bit more in detail in the next slide. So with conductive hearing loss, the patients will have a greater air conduction than bone conduction with the Ryan test. And then with the Weber test, they'll have a lateralization to the affected ear. And like I said, in the next slide, we'll go ahead and go over those just a little bit more in detail. And with sensorineural, these patients will have an normal external canal and tympanic membrane. So you won't actually see like a visual defect in these patients where you will with the conductive hearing loss. So these patients can complain of tinnitus and dizziness, and these patients normally talk with more of like a louder tone versus the softer tone with conductive hearing loss. These patients hear worse in a loud environment. And unlike conductive hearing loss, they will present the exact opposite. So with the Ryan and the Weber test. So air conduction will be less than bone conduction, and there will be a lateralization to the unaffected ear. Okay, guys. So we're going to go over the Weber and Ryan test a little bit more in detail just so we can kind of clear any confusion with that. So to help diagnose the type of hearing loss, there are a couple different diagnostic tests that are utilized. So one is using the tuning fork. So the tuning fork is used to conduct the Weber and Ryan hearing test. So the tuning fork helps us test the patient's hearing acuity. So with the Weber test, let's see here. With the Weber test, the vibrating tuning fork is placed on the middle of the patient's head, and then you ask the patient to indicate which ear is louder. With normal hearing, it should be equal in both ears. And then the Ryan test compares hearing by air conduction with bone conduction. So the vibrating tuning fork is placed in the patient's mastoid process for bone conduction. The patient is asked when the sound is no longer heard, and the tuning fork is vibrating, by the way, for this test. So You'll swipe it down your leg. It's going to be vibrating. You place on the patient's mastoid process. Ask the patient when the sound is no longer heard. So when it's no longer heard, we move the tuning fork to in front of the pinna, and this tests the air conduction. So the patient's again asked when the sound is no longer heard. So normally, sound is heard 2 to 3 times longer by air conduction than by bone conduction. Okay. And then with an otoscopic exam, the external ear canal, the eardrum, and structures of the inner ear are examined for any abnormalities. So imaging such as like a CT or an MRI can be used to help determine non-auditory problems. And then audiometry can help show whether hearing loss is only conductive or if it has a sensory neural aspect as well. Okay, so with management, let's go ahead and look at non-surgical and surgical management options. So with non-surgical management, we're going to be looking at early detection of hearing problems in the first place. So there's a couple different assistive devices that can be used, such as hearing aids, portable amplifiers, and cochlear implants. So hearing aids are helpful with conductive hearing loss, and they are less helpful with sensorineural hearing loss because they can make the hearing worse by amplifying the background noise. Cochlear implants can also be used, and they are helpful in patients with sensorineural hearing loss. As the problem is within the cochlea itself. One surgical procedure that's helpful for conductive hearing loss is a tympanoplasty, and this actually just reconstructs the middle ear, and it helps improve hearing. Okay, so let's go ahead and look at patient education. So first and foremost, we're going to be teaching about prevention. So patients minimizing exposure to loud music, wearing ear protection when they're at loud concerts, that kind of thing, and then avoiding putting foreign objects in their ears as well. We want to be teaching about hearing aid application as applicable and like cleaning and maintenance of the hearing aids as well. And we want to be using devices to help maximize communication and alternate methods of communication if needed. So like sign language, lip reading, closed captioning on the TV, kind of depending on their, degree of impairment. And then the assistive devices would just be hearing aids or cochlear implants or whatever the provider prescribes. 2 nursing concepts relating to patients with hearing loss include alterations in sensory perception and functional ability. So with changes in hearing, this not only alters their sense of hearing, but it also impacts their functional ability to do day-to-day tasks. Okay, guys, let's go ahead and go over the key points on today's lesson. So the difference between the types of hearing loss. Conductive is an actual blockage of sound wave transmission. And sensorineural is a problem with the inner ear and the cochlea or 8th cranial nerve, such as damage to the hair cells of the cochlea. And then mixed is a combination of the two. So with this one, they'll have, partial conductive, partial sensorineural, and both will be occurring at the same time. There will be different assessment findings for each type of hearing loss, such as tinnitus for sensorineural, and then visual obstruction for conductive hearing loss. A tuning fork is a helpful diagnostic tool and helps us conduct the Rhine and Weber test, which help us to differentiate between the conductive and sensorineural hearing loss. So I also want you to remember the management, so use of assisted devices such as hearing aids or cochlear implants, and then a tympanoplasty if indicated. Finally, we want to be teaching about prevention, so wearing ear protection at loud concerts, preventing exposure as patients are able, using assisted devices as indicated, and different things to help maximize communication. Okay, guys, so that is all on our lesson about hearing loss. Make sure you check out all the resources attached to this lesson. Now go out and be your best self today. And as always, happy nursing.